we have a very impatient society today. I think our lifestyle leads us to higher levels of impatience in terms of how we behave.
Yes.
And it's a function of technology, and it's a function of everything being available almost immediately, almost immediately. And if a new patient finds your office by, the most common way that people will find an office today is by doing a Google search, and they find your office, here's typically what happens. They'll do a Google search. Maybe it'll be, adult orthodontics Phoenix. I'm just making up terms, but that might be a term that someone would use. And your goal would be get on page 1 of Google. And now let's say you meet that goal, you're now on page 1, and the potential patient finds your website, and they click on the website, where hopefully if the website was designed right, it would go to the landing page all about adult orthodontics. Does that make sense, Naren?
Yes.
And let's say they spend, and again, what's the data? How long will a searcher spend on that landing page historically?
Yes, if they come from search engine optimization, meaning they come by clicking on an organic result, on average, they're spending 90 seconds. If they come from an ad, it's 15 seconds.
So again, another nod to why organic is more important, because you're going to get 6 times the amount of time they'll spend on the site. 90 seconds still isn't very much, but it's enough for that patient, if your website's designed properly, to give an impression that, oh, this is an office where I should go for this. And now they call the office. And now at this point, marketing has done its job. They got the phone to ring. And then, wait for it, it goes to voicemail.
Right.
What is that patient going to do, the potential patient going to do? I can virtually assure you today, they're going to go to the next office on their search.
Click, hang up,
and
go to the
click,
next office.
You've lost the opportunity. Now, true confessions. I have to share this with you because it's embarrassing, but it's true. So I have to share true confessions. This goes back a number of years ago. We have been using Weave as our phone system. Weave, you may be familiar with Weave, by the way, love Weave. And we also, it's our patient communication system. It's the way we connect with our patients by text message, by email, and voicemail as well. But love Weave. And the founder of Weave reached out to me a number of years ago and said, Gary, we have a new capability of Weave. We can tell you what % of your calls are being missed during business hours. Would you be interested in that? And I said, yes, of course I'd be interested in that. But I told them, but oh, by the way, we're doing really well at that. We've got multiple team members on the admin side. We've cross-trained dental assistants so that if the phones rang twice, if they're not with the patient, they're racing down the hallway to answer the phone. And I think what we're going to see is an office that does really good at answering calls during business hours. And he said, well, I'll have the data for you shortly, and you and I can take a look at it. Anyway, he got back to me and he said, hey, before I show you the data, he said, you better be sitting down. Uh-oh. I said, okay, I'll play along. I'll sit down. And we discovered that within a 3-month period of time, and a 3-month period of time is long enough to take the ups and downs out of, data to give you a realistic perspective of what's happening. The longer you run it, the more effective it is. So 3 months is better than 1 month. Would you agree, Naren?
Yes. 1
month could be an aberration, but by the time we get to 3 months and longer, it's a pretty accurate report. And we discovered that, wait for it again, we had missed 42% of our calls that were coming in during business hours. 42%. Naren, I can safely say that is a failing grade on the report card. I thought it was going to be single-digit percentage, something less than 5%, which I can live with.
Yes.
Perfect would be we would miss any, but I'm not sure that is necessarily our goal.
Right.
But I'd like to get that down to single-digit, less than 5%. To be a valid statistic. Now, let me emphasize, this is during business hours. If the call comes in at midnight, I'm perfectly fine with that going to voicemail.
Yes.
Agreed?
Yes, as long as it's outside of business hours, I think the expectation is, yeah, nobody's going to work outside of regular business hours.
Yeah. So, but during business hours, and I have to say, Darren, I was floored with that information. I was absolutely floored. And I believe that if I would have had the polygraph test, like the wired on my wrist where
Yes.
the lie detector test, and it would say, Gary, do you believe that your calls are being answered with less than 5% fail rate, during business hours? Oh, yes. I can assure you our data is less than 5%. And I believe that polygraph test would have said I was telling the truth because I
Yes.
believed with every ounce of my DNA that was the case. But
I think a lot of doctors were exactly in the same shoes as you, Gary. Even though they don't have the data, they believe that they are answering all the calls, definitely not missing more than 5%.